Post-traumatic stress disorder, or PTSD, is not just about a painful past or difficult memories. It's a mental trap that keeps you stuck in a moment you never want to return to. But science shows that the brain can be retrained, and you can once again help yourself feel safe. PTSD does not mean you are broken or alone. Healing is possible. And if you want more practical, science-backed tools like these, make sure to subscribe to the channel. Hello, everyone. My name is Dr. Syeda Quadri, and I am a psychiatrist. I have been working in this field for the past 15 years. Today, we'll explore how PTSD changes the brain and how recovery is possible through therapy, bodywork, relationships, and habits. So let's get started. 1. PTSD changes the brain's wiring. PTSD isn't just about memories, it's about how your brain reacts to danger. Research shows trauma can overactivate the amygdala, your brain's fear center, and shrink the hippocampus, which organizes memories. That's why the past can feel like it's still happening. Imagine someone who survived a serious car accident. Months later, they're crossing the street and hear a sudden brake screech. Their overactive amygdala instantly thinks, another crash is happening. The hippocampus treats it like real danger. In seconds, their hearts race, hands sweat, and muscles tense. This isn't just remembering. It's the body and mind reacting as if it's happening right now. The good news, the brain isn't stuck forever. Therapy can help rebalance that overactive fear system. 2. Therapy can rewire the brain. Talking about trauma doesn't just lighten your heart, it literally changes your brain. Therapies like EMDR and Trauma-Focused CBT train your brain to see painful memories as just memories, not danger. This takes away their emotional punch. In EMDR, the therapist guides your eye movements, similar to what happens during REM sleep, so your brain can refile the memory in the right place, making it less overwhelming. Think of it like moving a scary file into the correct folder so it no longer jumps out and triggers you. And along with therapy, your body plays a huge role in recovery. 3. Calming the body to heal the mind. If your body is stuck in fight or flight mode, your mind can't fully relax. Harvard research shows slow breathing, yoga, and regular movement lower cortisol, the stress hormone, and send your safe signal to the brain. Just 10 minutes of slow breathing a day can ease anxiety and improve sleep. But there's something else that's just as powerful: safe relationships. 4. Healing through safe relationships. PTSD grows in isolation, but connection can be medicine. According to the WHO, supportive relationships rebuild trust and help calm the body's stress response. Veterans groups or survivor circles often become lifelines, places where people truly understand each other. And the final step that locks in recovery: lifestyle habits. 5. Lifestyle habits as long-term medicine. Small daily changes can protect your brain for life. Healthy eating, quality sleep, and avoiding alcohol help keep your brain balanced and resilient. Even 1 week of good sleep can reduce flashbacks and stabilize mood. PTSD isn't a life sentence. With the right care, support, and healthy habits, your brain and body can heal, and you can feel whole again. If this video helped you, like it and share it with someone who needs hope. Tell me in the comments, which step will you start with today? And don't forget to subscribe for more simple science-backed mental health tips.